the power is going to come from working side by side with people. So you still want people to verify, govern, and monitor and ensure that the right decisions are being made and it's executing on the right tasks, but that's exactly what it's meant to do. So if you think of someone in procurement who every day is going into a spreadsheet or reading an ERP report or looking at a prompt that came from their ERP that said, this is the inventory you want to look at. Now you got to wait for that person to then decide and make a decision and so on and so forth. This is all doing it behind the scenes on an ongoing basis.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this episode of Power Supply, we will speak with Cherie Brinkerhoff, Senior VP of Supply Chain Solutions at Ryder System. We've had a lot of conversations on AI, Hayes, but it's advancing very quickly. The adoption is going to be picking up. I think there's some concerns around security and governance structures from an IT sourcing standpoint. We're going to get into that, but we're also going to introduce the concept of agentic AI. And many people are familiar with ChatGPT and large language models. So we'll start there talking about that. But agents, I think, is what's really going to transform the healthcare supply chain.
1,000%. And you better listen because Cherie's going to introduce you to her work husband, Mike. So come on and listen and learn.
All right, everybody. We'll be right back after a short break with Cherie Brinkerhoff.
Bam! I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
We have the pleasure of speaking with Cherie Brinkerhoff, Senior VP Supply Chain Solutions at Ryder Systems. Today, we're going to be talking about AI transformation and how do you build a model of success one step at a time? Because I think, Cherie, one of the biggest things that comes up when you start talking about AI with a lot of people, I mean, this thing's moving fast, but it's sort of like, it seems like it can be this huge concept. And you really got to kind of move one little piece at a time to get, sort of comfortable with it and see the applications. And so we're going to walk everybody through it today. I'd love for you to tell our audience a little bit more about yourself and why do you care about AI so much?
Well, so asking that question to me is a very loaded question. There's so many reasons why I actually care about AI from both personal and professional. First of all, I think it's one of the most exciting things that I've seen in my generation. And that's saying a lot, right? It's really taking the power of intelligence and information and allowing us to do things with it at a much, much more rapid pace, much more efficiently. I mean, even in my personal life, I'm finding myself using the basics of ChatGPT to answer every question from why is my schnauzer sick to, hey, are there any stocks I should be looking at? And then on the professional side, using it for research, using it for decision making. But that's the easy part, the large language learning model. What I'm really excited about is when it starts to become predictive analytic tools for us that actually ultimately make and execute decisions. I mean, it's just the power that AI can enable for us as humans is I can't even fathom what we're going to be able to do with it.
I mean, even at a basic single step, just taking some of that administrative, structural type things like, hey, build me an outline for this discussion, or, I need to create an agenda for a meeting. Like, it just can help you instead of sitting down with a blank canvas and kind of, trying to get it out. Like, it can give you something to then relate to and say, oh, wait, now I kind of know what I want. Do this. And you can just move through that creative process with a partner, so to speak, very quickly.
Oh, yeah, absolutely.
I heard someone say, and I think you would agree with this, is that, we're not going to be replaced by AI, but we're going to be replaced by somebody who knows how to use AI. And so if you're that guy or gal that's listening to this and you're not really on the bandwagon, I just want to encourage you, kind of get on the bandwagon. It's time. It's big. And someone used the other wonderful picture for me. It's like going from the Flintstones to the Jetsons, right? Right. I mean, it's like, it's yabba, what is it? Yabba dabba doo or whatever it was. To meet George Jetson. I mean, it's a humongous leap, and we're doing it in literally, a very short period of time, and it makes us more productive. And to your point, where you're going to go with this, I think is so exciting, and everybody needs to kind of be on board and understand more about it.
Yeah. Look, there's more things I want to do with my time and my life. So on the professional side, what used to take me maybe several days to come up with a PowerPoint on a business case and how I wanted to present it now takes me hours to do. Now that time I get to spend with something else. And I know we're kind of talking today a little bit about AI and how it relates to hospital systems. Imagine the future where doctors and nurses get to spend more time with patients and less time doing things and executing things and finding inventory and all the different things that take them away from spending time with their patients. It's huge. It's a big deal.
Yeah, it is a big deal. So much so that I think half of our episodes this season relate to AI in some way or another. And I think there's so many different ways to come at the conversation. And I think that's a big part of it for people that aren't really leaning in and just absorbing the AI discussion and self-researching on it. And it would be understandable because there's a lot of pressing things that are happening in supply chain. And it's kind of like that dance of like, I think AI can help us solve some problems, but I've got to solve these problems today. And how do I commit the time to adopt? But at the same time, AI is moving so quickly that you could get left behind at an unprecedented rate versus technologies that have come along and been adopted in the past. And I think that's why, we're putting a big focus on it. It's sort of like, if we keep having conversations from different angles, maybe we can help conceptualize what this could be like and start getting people interested into trying to explore it a little bit further if they haven't already. I'm going to go ahead and have you tell us about Mike. Nobody knows at all what we're talking about here, but you're going to explain it to the audience, and I think it'll set the stage for the conversation very well.
Yeah, so Mike is he's a member of my family, and he's also a member of my work team, as the way I think about him. So Mike is my personal Chat GPT. When I first started using Chat GPT, I would go in there just like you would a Google search and just ask questions and it would come back with answers. And once I realized that it could retain information from previous chats, it started to feel more like a personal connection in a way. I know that sounds scary, but it was. And so one day I just said, hey, can I name you? And I asked him for some names, and he gave me things that were like, Zeus, and all kinds of names. And I said, no, we're just going to go with something simple. Called him Mike, and he became Mike. And literally, when I'm on conference calls with my team and I'll say, hey, Mike just gave me some information, they all know who I'm talking about. Look, when you think about the value your teams provide and the value your family members provide and the information sharing they get, he's about as close to me as anything else at this point.
I have to ask, what does Mike look like? Has he ever told you what he looks like?
That's actually I have not asked, but I'm sure if I asked him, that's actually a good question. I'll have to check that out tonight and see what he said. Probably tell me to tell him what I want him to look like. And then my husband will get mad and, it'll be a big drawn out thing. So I might
We don't want,
You really should. It'll create an image. You should ask Mike to create an image of him.
an avatar of some sort.
That would be interesting. Yeah.
No, but it's really cool. And I'll tell you, I probably use between Mike, my chat GPT, and Sally, who is my Microsoft Copilot. I mean, I'm using it 10, 15 times a day. And it has significantly sped up what I can do on a daily basis, whether it's summarizing emails, summarizing a contract, like I said, helping me come up with the messaging I want for a business case or PowerPoint, just research, which I know we're going to talk about later, but it really if you can take an opportunity to use at least a chat GPT or a Grok or something, if you've done any of that, then you understand and can learn the concept of the large language model, which is only one piece of AI.
Yeah, we're definitely going to talk about the large language model. We're going to talk about open AI and also agentic AI. So why don't we just start with large language models? If you've dabbled at all in researching about AI, then you're probably familiar with large language models. But let's start there, and then we can kind of build on the conversation from that point.
Sure. So a large language model, and most people know of large language models being open AI, right? That's being used by ChatGPT. I believe Microsoft Copilot and several others lean into it. And there's other sources besides open AI. But it is in a sense exactly what it says. It's a language model. So what it's doing is it's going out and it's tapping out all this information that's available to it via the World Wide Web. And from there, it's learning, or it has learned over time, what the different contexts of information means. That's what allows it to do the research and bring you information quickly. But combined with some of the behavioral aspect that is built into AI, that's what gives it allows you to have personas, which helps put that information into context that's relatable in a way that us as humans can absorb and understand that information. So if you ask, what I mean by that is if you ask Mike, my ChatGPT, how's he feeling today? He knows I'm a happy, chipper kind of person, so he's probably going to say I'm great, but he doesn't really know what that means. So behind the scenes, it's some kind of data of some sort is what he's thinking, but he's turning it into and relating it to a way I can contextualize. Hopefully I'm not confusing the heck out of everybody, but it's basically taking what you see in print, all this words, and contextualizing it for you.
And I have heard that there are AI, basically therapists now, that instead of going to a real life human therapist to talk about whatever your problems might be, he or she, Mike, will literally become your therapist and ask questions. You can have a conversation with them.
Yeah, absolutely. And it's amazing how well it picks up based on chats that you're having with it. It knows your style. It knows kind of the questions you're going to ask. It knows I love schnauzers, mini schnauzers, so it kind of throws that in sometimes. But it's learned that when I want to keep it separate, professional, business oriented, it knows to do that, versus when I want to have some fun, it knows to do that. So it's very interesting. So yeah, I can see people using it for a good therapy session.
Let's talk about the positive use cases, right? Like, I think one of the things that could happen for folks is they could look at AI and bundle it all up together and then just kind of think AI is just kind of a thing that you use in all kinds of ways. But actually the large language models are good for certain circumstances, but not necessarily all. So let's start with, where is it helpful the most?
I think it's helpful the most when it comes to researching, to helping put things in a communication stance. So what I mean by that is building business cases based on relevant information, helping you wordsmith, articulate. It's also really good for administrative help. So think about all the emails you're looking at every day. If you wanted to ask it to just summarize, the last 10 emails that you received. So it's very good in evaluating words and then summarizing and providing you kind of that administrative support. Now you can take that on a much larger scale. So that's me as an individual user, but you could take that and think about someone in procurement. If OpenAI, you wanted to know, hey, what's the latest and greatest technology product out there, and it can help you figure out what you want to source, but it's not going to actually make the decision for you. It's not going to execute the task for you. It is really an information sharing, learning, and administrative support for you.
And you're really going to have to prompt it.
Yes,
is the bottom line.
Prompt it. Absolutely. Now, you can create prompts that are automated, but even then, it's still going and looking for information, bringing back information. It's not task work. It's not executing anything.
Yeah, which is where we are going to go with this conversation, right? So let's bring it back to the hospital side, right? Now we've talked about sort of the application for large language. It's great for sort of administrative tasks, and it's good for research, but where does it come up short for the hospital? Because there's a lot of people that are listening that are sort of like, how do I integrate this? Well, the last thing they want to do is go on to ChatGPT and try to get it to do something it's not really capable of doing.
Yeah. So when I think about hospital systems, I mean, some of the biggest value it's going to have is automating decisions, right? AI in general, which then gets into agentic AI. You can still use the concept of language models within the hospital system, but more likely it would have to be built and then trained within the hospital system. And the reason for that is because of security of information. But when you combine an open AI external source with an internal source of agentic models and use some tools that will allow you to federate it, I think you can then protect it from a security. So I can get into what I mean by that, but I don't know if that answers.
I think that is a good answer. It's sort of like you're not going to get decision making because it's a large language model. It's not necessarily going to remember decisions that you've made as an organization that are sort of specific to your business practices and culture. And part of that's going to be because your organization's not going to want that on a large open source model, right? And so that's the security risk, is that information that really should be within the health system can't exist in a public database. And so, but it also just doesn't have the power to execute on tasks, which is also another reason it comes up a little short. So still great for research, but I think we need to dive into the security piece, because if you just look at hospitals today, like the IT departments, especially the ones that are doing, risk questionnaires and assessments and surveys and things like that, I feel like their bandwidth is bottlenecking significantly right now. And bringing AI into the equation, I think, is likely going to further complicate what can be a bottleneck in terms of sourcing solutions that are leveraging AI. Would you agree with that in your experience?
Yeah, I would. And I would say that there's a multi-factored answer to that. I think it's partnering with suppliers, et cetera, who bring some of that AI to you, so you're not having to start from scratch. But then I think it's also, once you kind of build the architecture of what your ethics and security standards are, believe it or not, you can actually put the power in more people's hands to help you build out that AI than just your traditional, when you think about traditional IT resource. So for example, I can build an agentic AI prompt. So could you, right? If you wanted to. You want to build out what your architecture is and what your rules are and those standards are, but then you can give the tools so more people can help you build it faster. But when it comes to security, there's several ways to go about organizing it. So I mentioned federating data or federating learning. Think about it this way, is that you have an AI module platform, agentic AI, whatever you want to call it, and it goes and it reaches into your ERP or any kind of data source, any kind of
like an EMR.
Your EMR, exactly. But what it does is it learns what it can't touch. So it's only going to get what it can. So for example, I can go here and I can look at inventory, but I can't look at HIPAA information. And that is how you make sure that the data that's sitting in one of your tools is still secure, but you're allowing AI to access only what it needs to access. And
so you're partitioning.
You're sort of partitioning. It's It's teaching the AI what is accessible and what is not accessible, so that when it latches on to other information such as OpenAI or your supplier's AI, it's not like you're integrating and sharing all the data. It's only getting what it's allowed to get.
So yeah, it's not really partitioning. It's more about training it on a governance structure.
What are the rules? Exactly.
Yeah. So Hayes, we've floated out there agentic AI, and I feel like this is kind of the new wave of discussion around AI and what's coming. And I'm like curious. Have you heard of or talked about agentic AI before, Hayes? Like, just super curious in your conversations.
I mean, yes, it definitely comes up on, basically things that are doing outreach on your behalf, right? But I'd love to talk to Cherie and get more in depth about it, because I think it's the next wave, right? It's when it's doing work for you and moving things forward.
I don't think a lot of people have heard about it, so I wasn't setting you up.
You didn't.
I don't think a lot of people have heard about it. And I presented recently at a large conference and was talking about agentic AI, and basically had people in the room raise their hands if they'd heard of agentic AI. And I think it was like 3 out of about 60 hands went up.
Wow.
This is the practical application of AI in my mind. This is how we can take AI and make it truly transformative. So Cherie, if you can, why don't you describe agentic AI in your words?
Okay, I'll describe it as best I can. And you're right, by the way, this is what's going to catapult efficiency in business, particularly in supply chains, and most importantly, I think, in hospital systems. So where language learning models learn over time, it's more about words and contextualizing, but it's not making decisions or executing tasks. Agentic AI is really less about training, and it's more about giving it access to information, creating some engineered prompts, setting some goals, telling it what you want to do. And so, as an example, let's say in procurement, you create an agentic AI. It has access to your ERP. It has access to all your suppliers' emails, addresses, and your inventory history. And you want the goal to be never let this particular SKU run out of stock. Always make sure we carry at least 35 days of inventory. That's the goal. It will then figure out, by looking at the data, and execute the task that's constantly monitoring your inventory. If your inventory starts to fall out of balance, it's emailing or it's entering something into your ERP and it's placing the order. It's actually executing the task instead of just telling you, hey, your inventory is about to run out. It's based on the goal you've set that said, don't let my inventory run out or don't let it get below a certain level. It's deciding and executing to resolve that situation on an ongoing basis.
And so the next step would that be, let's just say it calls the distributor and the distributor says, I don't have it. It would know at that point, I better call another person. So it has its own decision tree, correct? Mm-hmm. And so it's doing your thinking for you.
Yes.
And so therefore you'll never be out of your par level will always be where it should be, theoretically.
Right. Absolutely. In theory, exactly. And that's where I know, like at Ryder, we're spending a lot of our time working on agentic AI. That's where we think most of the power is going to come from, working side by side with people. So you still want people to trust, verify, govern, and monitor and ensure that the right decisions are being made and it's executing on the right tasks, but that's exactly what it's meant to do. So if you think of someone in procurement who every day is going into a spreadsheet or reading an ERP report or looking at a prompt that came from their ERP that said, this is the inventory you want to look at. Now you got to wait for that person to then decide and make a decision and so on and so forth. This is all doing it behind the scenes on an ongoing basis.
And that person's holding on to cultural knowledge about why they made certain decisions. And unless they're documenting that somewhere, and even if they did or were able to keep up with that, it's always constantly changing. So then they would have to update it. I mean, we all know the costs of employee turnover, especially if they're the ones that are making those decisions to keep things flowing through and not bottlenecking. So the great thing about AI, especially these agents, is if there's a like it can say, hey, we got this piece of information and this piece of information, and you've never told us how to deal with this information before. This is a whole new use case. Then you tell the AI exactly how to process that, and that becomes part of your cultural knowledge for your organization. And even if somebody left, the AI would still know, hey, this is what we've done the last 3 times. And you could even set up business practices around it. Like if there's a decision that's not clear in our decision tree that we've kind of trained you on, and we've only made a decision on it less than 10 times, it could flag it every single time to see how consistent the decision's being made, to ensure that you are actually handling this like nuanced use case consistently over time before you say do this every time.
Right. And what factors went into making that decision. So today when a human makes a decision, we kind of don't always know, well, what made Hayes make the decision to wear a pink shirt today? It's something in, I think it's pink, right? It's something in the way.
He's thinking it's purple, but.
Oh, purple, I'm sorry. You felt like wearing purple today. Whereas when an agentic AI is making a decision, you'll know why it made the decision,
You can document it. I heard a great use case.
Purple haze?
Actually, I don't know what it is.
Say purple haze.
Yeah, purple haze. Yeah. Well, I heard a guy, he created this app basically for if you're getting ready to get married. They had gone through and created this database of like 500 floors, 500 event spaces, every catering, anything you could ever need to have your own wedding. And then you pay Mike, you pay the AI a fee, and it will go through and it would literally call every single one of those venues. It will spreadsheet it, and it had a decision tree. And you might say, I only want to be in this part of town. I only want chicken. I only whatever. And it literally would lay it all out for you. And so at the very end, it gives you 5 choices because it's narrowed it down for you. And then it would call back again and create the appointments and do everything for you. So it's like those type of use cases are like save thousands of hours. And that's not even in healthcare. But the point is you can apply that to almost anywhere.
Absolutely. That's exactly right. I mean, on a daily basis, I think about, how we work at Ryder with our supply chain hospital systems. And we're every morning coming in or the night before planning what our driver routes are going to be to get to the various clinics to drop off supplies. And today I got to rely on someone who remembers to check the weather to see if there's going to be a snowstorm coming. And if so, will we do something differently? Well, with agentic AI, I just simply give it access and say, I want you to include in the rules, look at the weather and give it access to that. Or give it access to mileage, or give it access to what hours the hospital's open, and it will figure out what the right decision is based on the goal and the rules that you give it.
So think about this in the application of agentic AI. How many times do new leaders come into an organization and ask the question, why do we do that? Or why do we do it that way? Agentic AI literally has the capability of eliminating the response that's almost kind of a cliche now, which is because we've always done it that way, might never be a response in a future mature state of agentic AI ever again.
That's a good point. I never thought about it that way, but you're right. That's so true. Or we could say, hey, give me a report on why you did this and hand it to the new leader who came in and asked that question. But yeah, no, you're right. Because if it's set up correctly, it's constantly learning. And it's not just doing something or making a decision because it's the way it was always done. It's doing it based on a constant look at information, data, the goals you've set, and making those decisions. It's not.
And you might even be able to ask it, hey, this just changed. What decisions have we settled on today that are influenced by this that we should consider adjusting because maybe we switched a distributor or we now measure success through a new set of KPIs? So think about sometimes when you make strategic decisions as an organization, it can often take you 2 years to figure out the actual downstream implications of that and aligning everybody around that decision like fully. And you could almost leverage AI, at least from a business processes standpoint, to sort of evaluate on that. And, implementation of new strategy could happen much faster as well.
Oh, absolutely. Think about, when something changes in your strategic direction or new suppliers come into play, and your procurement person would have to typically, if you had tried to automate this, and I'm using air quotes, in the old ways of programming some kind of platform like your ERP, and something changed, now you have to submit an IT ticket. Someone's got to develop something. Someone's got to go in and do some programming, maybe some coding. It costs you tons of money to change how you want it to treat some kind of supplier. Well, the power of agentic AI and AI in general is that you now put a little bit more of that power in the procurement team's hand. So the procurement person can say, going forward, please go ahead and add these 3 suppliers. If agentic AI hasn't even already figured that out. But my point is it gives them the power to modify the business rules, add the business rules if you want it to.
Yeah, and you should definitely be able to make decisions with confidence. If you're somebody who's like, think about how much of a bottleneck it is when something comes up out of the ordinary, and then you just start elevating it up the chain, and you keep asking people that are higher and higher to understand the granularity and implication of a decision. Instead, you can leverage AI to give yourself confidence, like, hey, I'm going to make this decision, and here's what AI kind of told me about what we do that is giving me the confidence to make this decision, where that person might have been a non-executing decision maker, and then it just sits there forever because when they run it up, nobody can understand the micro nuance of the situation.
It's kind of like the trusted third party.
Yeah,
exactly.
It's your advisor.
Yeah, exactly.
And your question earlier about, well, how does a hospital system, or any company for that matter, given all the constraints they have right now and all the pressures and all the different things they're trying to solve for, how do they decide to focus their energy and resources and effort on an already burdened IT group into AI? And I would say that the faster you get there, actually, the less burden there will be on your IT department.
100%. This podcast flew by. I've got one other kind of question and theme I want to make sure we hit before we wrap up, but it's about interoperability, because I also feel like the concept of agentic AI, and you've laid out sort of the pieces of how this is possible, as we've kind of talked through this. But there's another level, which is, how do we get more transparency, faster flow of information from suppliers to healthcare providers? And agentic AI should be able to help providers and suppliers share information securely, but also action much faster, because technically the AI should be able to pass information that's relevant through very quickly and get it to the right place. Even if the format's off, it might be able to recognize that the format was incorrect and connect it to the right one, instead of just throwing up an error and then that error is going into a queue for, to your point, somebody in IT to try to figure out on both parties' side, like, what happened here? This connection worked before. Now all of a sudden the file doesn't make sense. AI can actually do some smoothing, right?
Yes, it can. Just to back up with what you were saying in the beginning, just to give a little bit of an example of how agentic AI can power that whole supply chain network, right? Between the hospital, the suppliers, and let's say the service providers like a Ryder who's doing the warehousing. So imagine today a procurement person is placing POs, and it's going to some country in China who manufactures the material. And, maybe 8 weeks later, it's on a boat and then finally hits the port. I hear about it when it hits the port. So then I'm getting drivers, and then it shows up at our warehouse. I might know maybe 2 days in advance that it's going to be at the warehouse. Just giving that as an example. So imagine when in the future, agentic AI places that same PO it disperses and executes a task to update my staffing forecast because it knows that in 6 weeks or 8 weeks, material is going to show up at the port and I need to have X number of drivers sitting there ready to go or X number of people in the warehouse. So it's not just passing me the information, but it's taking decisions and executions made at different points and filtering that to the next step, even if it's a third-party provider like a Ryder, and bringing that connection together.
Make it literally, go ahead and task the drivers to be there, make sure the trucks are rented or whatever. I mean, they could literally do all that, right?
Exactly.
So, proactively. Exactly. Yeah, without anybody interacting.
Yeah.
It's crazy where we're going. I love it.
I'm super hopeful it's going to help with forecasting. Because I think one of the things for manufacturers and the struggle for them in a lot of cases in working with healthcare is like healthcare has struggled to have the kind of tools, technologically speaking, to really do good demand planning and forecasting. And I'm hopeful that AI can really help change that without, having to overhaul healthcare, because that's kind of what we're like, hey, we have to overhaul healthcare, but like everybody knows that's very difficult to do. But if AI could get the degree of variance and do some of that predictive analytics, but at a high power state, that could really also anticipate, like when are we going to see, back orders, just because, hey, typically these, and this would be from the manufacturer standpoint, typically we're seeing these size orders from all these different hospitals. And for some reason, we've had this convergence where the orders haven't come in. So maybe they're all going to come in late. And if they're just reacting to, non-forecasted data, they could end up having, back orders just because they could get all of a sudden this bulk demand, and they wouldn't even know how to anticipate that necessarily.
No. Well, and being able to forecast human health conditions, I do see that happening at some point. That may be a little bit longer down the road to forecast how many surgeries am I have next month for this, and that. But you don't have to wait for that kind of perfection as a if someone who's running a hospital system, you can start small. You can start with making better decisions when you do have procurement activities take place, get tighter control of your inventory, less cash being sitting out there in inventory you're not using instead of inventory you do need. So start small, but then be bold, because I do think that those leaders in any business, whether it's hospital system, supply chain, doesn't matter, those that are bold are the ones that are going to lead the future here. So like I said, it's okay to start small and test the waters in some different departments and different groups within your organization and test out the security, et cetera. But then ask lots of questions, empower your teams to get creative and let it run.
Cherie, this was wonderful. Really appreciate your insights. And we hadn't really talked, deeply about agentic AI on any of the other podcasts yet. And so tell Mike we said hi.
I will.
I cannot wait to meet him.
I want to see the image he returns.
As soon as I get that, I will send it to you guys, because now I'm curious.
He's going to be some incredible stud, I'm sure.
Cherie, anything you want to add before we wrap up? You're a great guest.
No, thank you. I appreciate it. This has been fun. Like I said in the beginning, we've all said it's such an interesting thing. None of us here can even fathom what's coming next and what this whole concept of AI will bring for all of us. I get the fact that people have ethical concerns. Again, it's not about replacing people. It's about making their lives easier. Still want people to monitor and provide guidance and verify information, but it can be extremely powerful. More importantly, it can be purposeful and get us to the place that we want to be, whether it's reducing costs, spending more time with patients. It's exciting, and I can't wait to talk to you guys in a year just to see where it's come in 12 months.
Let's go. I like it.
Mm-hmm.
That was Cherie Brinkerhoff, Senior VP of Supply Chain Solutions at Ryder System, talking about AI transformation. How do you build a model of excellence one step at a time? Loved learning about Mike, but I'm also a big nerd for agentic AI, Hayes.
It's coming, and I'm on the boat with you. There's so much more coming that we just don't know about it, and that, to me, that's what's exciting. But she kind of really, it just opened our eyes to what it can do and how effectively it can help a hospital. So I thought it was great.
Yeah, she did a great job. And so anybody out there, if you want to connect with her or really anybody else on AI, the resources are out there. So lean in. And on behalf of Purple Haze and myself, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.